Well, we've been talking about an uptick in positivity rates and hospitalizations as it applies to coronavirus. And now we're seeing coronavirus cases have risen in half of the country. So to talk this surge, we're joined now by Dr. Andre Campbell, professor of surgery at UCSF and a trauma surgeon at the Zuckerberg San Francisco General Hospital. Doctor, thank you for rejoining us again. I want to talk about this latest uptick. Do you think that we're on the front end of a new wave of this virus?
Well, thank you so much for having me back. I really appreciate it. It's good to see you, Ms. Myers, this morning on the West Coast, afternoon on the East Coast. We have a lot of concerns now. So we are now 8 months into what's going to be probably a year and a half or 2-year cycle where things will not be normal. Regardless of the political landscape, the public health point of view is that we're really very early on in this entire game. And the thing that we're worried or a fight, really not a game, it's a fight against the virus. So started in February, now here we are in October. The thing we're worried about now is getting cold in the Northeast, Midwest, and the West, and that people going back inside so that there will be maybe a double whammy. There will be a resurgence of COVID, which we know last week we went up 13%. 45,000 more cases across the country, hotspots everywhere. But we're also worried about the flu. That's why we're trying to encourage people to take the flu vaccine, because the flu vaccine, you should have that on board no matter who you are. So we're worried about this second wave coming. The other thing that we're worried about is in Florida, where everything has opened up. And that is something that is quite stressful for us, is that opening up at 100%, when you open, you don't open up at 100%. You open up at a lower level so you can have all the things we've talked about with social distancing, hand washing, wearing masks, those kind of things going on. So we are very worried about, yes, there will be an increased second wave, and there has been increases in the central part of the country more recently.
So speaking to those reopenings, not just Florida, San Francisco, your city, is also mulling over these reopenings. New York has also reopened indoor dining and also sending children back to school. Now, I know that economically people are saying, look, we cannot hold on for much longer. We have to do business, especially restaurants. Do you think that these reopenings, and you were hinting just a moment ago, but are they premature?
Well, I think when you reopen, you have to do it smartly. I think the reason why the reopening is happening is because the incidence, New York went from being the epicenter with having 400,000 cases, 32,000, New York State, 32,000. That's New York City, obviously being tremendously affected and having 20,000 deaths, to now having less than 1% positivity. And that's kind of what was the impetus. So each state has a set of guidelines. Our guidelines in California, much like the guidelines in New York, is that if we have less than a percentage in a county or city and county like San Francisco, so I think we're about 1% positivity of the tests that we've had here. And if you're at that level, then you can think about opening. But when you open, you have to open smartly. Everybody wears a mask, everybody social distances, everybody washes their hands. We must do it in a very smart way. And you may need to do a combination hybrid where some open, some at home. Some of these things that are very disruptive to people's lives, the closing of the restaurants, the closing of schools, it hurts people who are working. So we're still very early on in this, and it is nowhere near the end as some are predicting. We're just really beginning the first 3 innings of what's going to be a maybe 9 or 10 inning battle against this virus.
So, Doctor, as I had been mentioning at the opening of the show, the president has decided to hold a rally in Wisconsin in coronavirus spread zones. And of course, famously, Herman Cain died after attending one of his rallies in Oklahoma. We see that these rallies are often maskless. There's little social distancing. Do you think that the president is being irresponsible and reckless and potentially contributing to the spread?
So I look at each and every one of those events as a super spreader event. So whether or not it's in Tulsa, Oklahoma, where Mr. Cain died because he got exposed to coronavirus in a large setting, or wherever he has, every time there's an event, there's a potential for super spreading. Every time you get close, you put people together. It is, in my opinion, a dangerous thing to do in a red zone. It's dangerous anywhere where you go in and have a big event. And the big rally that was in South Dakota with 250,000 people, they've now traced thousands of cases related to that. The wedding in Maine, where there were only 80 people in the wedding, and now it was over 200 people been affected with 4 people dying. So whenever there's an event where there is no concern for the public health issues of distancing, wearing a mask, spreading the virus, to me, it is a super spreading event. It is not advisable to have anything like those events happen anywhere in the United States when we're at this stage of fighting this virus.
I only have about a minute left with you, doctor, but I wanted to ask about the vaccine that is largely unpopular to most Americans. They say that they don't want to take a first generation vaccine. They do not trust the president, even if he tells them that it would be safe. I'm wondering what your thoughts are on that. If a vaccine comes out by election day or even by the end of the year, if you would encourage folks, given how quickly a vaccine came out, to take it.
Well, that's a little bit more than a minute, but I'll try to give you as quickly as I can, if that's okay. So vaccination and vaccine development is important. And obviously, this is very compressed. So for me, I would not take it if it is done on a politically expedient basis. Now, if you listen to Anthony Fauci, and we all listen to him, he would say second quarter of next year, where it will go through all 3 phases, safety will be proven, and it can be then distributed. I don't think there's any way that anything safe can be done before that. We have a lot of people who doubt vaccines. Rolling out a poorly thought out vaccine is the worst strategy for the vaccination against this disease process. You have to have trust. You have to support the science. And I do not think that anything is going to happen. There may be an October surprise. They'll say, oh, it's out. But I think as a public health person, I would not advise taking it until it has been thoroughly vetted, and it is nowhere near being close to being thoroughly vetted at this time.
All right, Dr. Andre Campbell, professor of surgery at UCSF, thank you so much for coming back on the program.
Thank you so much for having me on. I really appreciate it.